And welcome to the Flan Foundation for Mental Health. I am your mental hygienist, Morgan Rector. Sometimes the solutions to a patient's mental health problems are very obvious. It may be related to negative thinking patterns or decision-making that is counterproductive or even self-destructive. What if the solution isn't that obvious? What if the source of a patient's turmoil is a mystery even to them? What is the next step in treatment? Hypnotherapy may be the answer. Yes, sometimes locating the source of a person's anguish is low-hanging fruit, but there are other times when it's a matter of excavating deep into the psyche. Through hypnosis, this can be achieved, and our guest today specializes in locating those areas that one cannot normally access from the bowels of their psyche without the assistance of a hypnotist, who can clear their brain of periphery and static and focus their concentration more clearly. And our guest today is Lesley Mitchell-Clarke. Thank you very much for joining us.
Oh, thank you, Morgan. I'm so very pleased to be here and to be speaking to your listening audience. It's a great honor. Thank you for having me.
Oh, likewise. So first of all, what inspired you to take up hypnotherapy as a profession or as a specialty within psychology?
Well, that's really a very interesting question to ask. And I have been involved in mental health care for many, many years, although I had other contiguous careers that were going, simultaneously. But my first exposure to working with persons who were experiencing mental health issues was in the unfortunate, state mental hospital type of situation, first as a high school volunteer, and then later as a psychiatric aide, and then later as a psychiatric technician. And I am so bloody old that this really goes back. So when I first began working in this area of mental health, it was, and if you can even imagine this, it was just only at the dawn of what we would call psychotropic medications. First of all, there were very few. Prozac was years away. There were no antidepressants. There were Thorazine-like medications to be used really for psychosis. And of course, nobody knew anything about dosing. So hence the Thorazine shuffle. Everyone was medicated, but at least they weren't in straitjackets or in padded rooms or contained in hot bathtubs. I mean, we had all of that. It was really positively Victorian, really, when you think about it. So throughout the years, and of course, my university degree is in theater arts and also psychology, and I went on to work further in these areas. I began to, I suppose, lose faith in talk therapy alone for a lot of reasons. Firstly, I think people are very invested in their stories. They are their stories. And I'm not sure that repeating their stories again and again and again helps anyone to release trauma or sadness or abandonment or attachment disorder, whatever it is. I think by repeating the story, little progress is made. And if I could point out a flaming example, that would be, of course, Woody Allen, who has been on the couch with straight-ahead Freudian therapy for 60-plus years, and then he goes and, molests his stepdaughter.
He got worse somehow.
He got worse. He got worse. Yeah. So, there you have it. Now, I was at a point in my life where I was ready for a big transition of some sort. I had been very successful in the music business in a lot of different ways. I'd worked a lot as an actor, as a publicist. I've done a lot of things. And my husband, great guy that he is, your listening audience may know him, Terry Clark, jazz drummer, well-known guy, member of the Order of Canada, the only jazz drummer to be such. But bless his heart, he gave me a gift certificate for a past life regression experience, knowing somehow that it was going to inspire me. He didn't know how. Well, not only was the experience itself completely fascinating, but I said, I can do this. This is what I'm supposed to do. I'm supposed to take all of my, medical training and knowledge of pharmaceuticals and combine it with this type of modality and help people to heal and move forward in their lives, and hopefully without, a whole lot of meds. Now, I'm not going to say throw away your meds at all. In fact, very commonly when I'm working with someone, they are also pursuing a simultaneous medical treatment. And certainly if I become aware of the signs of clinical depression, or if somebody is talking about self-harm, then I don't work with them. I refer them immediately and get them to the hospital, or drive them myself if I have to. But, that's kind of where that's at. But when you're talking about hypnotherapy, it's ancient in the extreme.
Sure.
It's 5,000-6,000 years old. I mean, I believe older, because I think that we had other civilizations that we no longer can remember due to our global amnesia. But at any rate, the Greeks had what they called sleep temples.
Yeah.
And, of course, they did the process a little bit differently. They used an opiated drink, which I don't generally use.
It's probably illegal, I guess.
Yeah, it would be, I think. But, they felt you had to use a substance to get yourself into the zone. But we talk people into the zone, and it's healthier and better.
Yeah, in the 20th century, hypnosis acquired a lot of baggage because of the stage hypnotists, like Ravine, the Impossible, all these people. By the way, did you ever go see him in concert? Or?
Well, I am. I'm from the United States. I'm a New Yorker, and I sadly am not aware of Ravine, though I have found some YouTube footage of him. But you're right. The idea of hypnosis as a medical treatment somehow became really devalued, and when there became mentalists and stage hypnotists. And stage hypnotism, I must tell you, has a lot of trickery involved.
I'm sure,
as you may suspect.
Well, my mother went to see Ravine, and he said, I can help you to quit smoking, I can help you to lose weight, but yet somehow he's turning this off and on stage with people, with a crowd there.
Yeah.
I don't see how that's possible. Actually, and what I'm going to ask you now is, I want you to set the stage for one of your typical hypnosis sessions. The way I discovered you was that I was walking down Danforth Avenue, and I saw in a doorway that you had your sign there, and I thought, well, she'd be a great guest for the show. So I went up to your door and knocked on it, and there was no answer, and then I tried pushing it open. It was locked, and I thought, okay, she must have a patient in there. She must be conducting a session right now. So set the stage for a typical hypnosis session. Walk me through the whole thing.
Oh, okay. Well, as you mentioned, many people come for what you would think of as garden variety things. They need to quit smoking or stop using some other addictive substance, wealth, pain management, phobias, you name it, we do it. So the first thing I do is I will consult with the client, and I can do that either on the phone or in person. They can come and see me for a half an hour at no cost and tell me, what's doing. And at that point, after they fill in the intake form, I am able to see if, they've been under, psychiatric care, which doesn't necessarily mean I have to avoid treating them, but I just need to know. I need to know what they're taking as far as medications, if any, et cetera, et cetera. So if everything looks good, and if they feel to me like a good candidate for hypnotherapy, and I can't quite put that in a bottle. I think it's instinctual. I think people who are meditators regularly, who do some kind of mind-body discipline, will generally be very good hypnotic subjects. And people who are just suggestible by nature. It's just a quality. So I don't want it to be a battle. I don't want them to go, well, you got to prove to me that this works. That's not going to happen. Somebody has to be going with the program. And I should also say that all hypnosis is self-hypnosis. All of it. I am a guide. The myth of the Manchurian Candidate type deal where you can go in and through hypnosis mess with somebody's ethical moral code or make them do something they don't want to. There's no way that that can happen in hypnotherapy. And I'm not saying that it couldn't happen with perverse other things being involved, certain drugs, or I'm not saying it couldn't be twisted up to do that. But what we do, no such thing. So then I make sure that the person is comfortable and comfortable with me, and that is essential. I have to make that person feel basically like they're back in the womb. I mean, they have to really be physically, mentally, spiritually comfortable. And the Bloom Center for Hypnotherapy, where I primarily work, we have a setup with two very comfortable chairs. They're kind of like what would you call a lazy boy chair. So we don't use, nothing that's psychiatric. We don't use beds or day beds or anything like that, generally speaking. So then the person gets relaxed and they sit down in the chair and maybe they've got their shoes off. I usually give them a blanket. And then I just begin relaxing their body from the top of their heads to the tips of their toes. I take as long as I need rather, to allow that person to let go. They have to feel that they can let go. Now, basically what I'm doing is I'm not only relaxing the body and speaking to the subconscious mind, but I'm distracting the conscious mind. I want to push the conscious mind out of the way, or at least, back of the line, right? So so I'm doing kind of two things at once. Now, that part of the hypnotic process usually takes about 10 to 15 minutes, something like that. And then when I know someone is in a good trance, and I do that, I know that by looking at certain physiological things. I look at circulation. I look at the slackness of the jaw, muscle slackness. I look also for REM state movement in the eyes. I would probably pick up a wrist and make sure that it has no resistance. And also I will, give the person the suggestion that their arms are too heavy to lift and that their eyelids are too heavy to open. And when all of that goes down, after about 15 minutes, then I count the person down farther. And I just say, usually I'm going to count from 20 to 1, and at each count, you will double your level of relaxation and comfort and, et cetera, et cetera. And then once that the person is where I want them to be, then we get into the material about the subject at hand, which could be releasing old trauma. And you don't have to make people re-experience it in a visceral way to do that. We can do it in a very benign way. But so it's either releasing trauma. Sometimes it might be exploratory, where we have to find out why someone is engaging in a certain behavior. And in that case, I'm also a neurolinguistic programmer, NLP, which is another form of hypnosis. It's just a little more manipulative, I would say. And if we don't know what's going on, we might use something called parts therapy, which, and then for sure the person is able to locate the essence of the problem and how to solve it, because the client always knows how to fix what's going on.
Yeah, but then, it's like for myself, I have some areas of my psychological plumbing that need to be cleared out, so to speak. I have a social anxiety, and that's something I don't turn it on, and I can't turn it off. It has a life of its own. So for people who have a condition like that, where there's a lack of control, are you able to resolve problems like that?
We're able to give you control. Social anxiety is way up at the top of the list of things that I deal with that are common. The most common reason people come for hypnotherapy is fear of public speaking, which is in essence the same kind of thing. It's fear of judgment, fear, it's complex, but we can actually we can use a lot of wonderful modalities to allow you to release endorphins when you need to, and to become aware of when you feel uncomfortable and to stop that feeling before it accelerates. It's just like with pain management. The idea is not to let someone suffer with the most extreme amount of pain that they can feel and then beat it back, right? The idea is when someone is having a pain management situation, as soon as the pain begins to manifest, that's when you medicate. And then you don't have to beat it down like that. So social anxiety is a very human, very treatable thing. Now, you may never, going to parties and stuff may never be one of your favorite things. It's not one of mine, believe me. But with hypnotherapy, we can make it so that you have to go to something, or maybe you want to go. You can go in and out and float above everything and have a good time and not be stressed.
So is it, I'm wondering if a lot of people assume that, well, this must just be a cure-all, like I'm going to wake up and it's gone. Is it that, or is it like every other kind of therapy in that you're given tools and you have to fix it to a certain degree yourself?
Well, it's in the realm of therapies, it's pretty, what's the word I'm looking for? Not benign is not the word. The person involved doesn't have to do, it's pretty passive. It's not like cognitive behavioral therapy. There aren't going to be exercises really. I sometimes give people homework, which means reading a certain thing or, in some kind of mild way. But what I do, and not every hypnotherapist does this, but I believe that there is tons of evidence to support that hypnotism, one of the ways that it works is through repetition. Hypnotism is like advertising. In fact, advertising is a dark form of hypnosis.
Sure, yeah.
And they hire people like me who walk on the dark side and want to manipulate people and tell these, junior geniuses how to do it.
Is that the same kind of thing as brainwashing, would you say?
Well, it's a real temporary. I wouldn't call it brainwashing because
not what you do, but I mean,
I think manipulation is a better a better term because it's very temporary. It has to be reinforced. So when I see a client, I record the session on my little MP3 player, and then I send it to them, and I have that client listen to the session every night before sleep. Now, the reason we do it before sleep is because when we're getting ready to actually fall out, the brain starts releasing a lot of the same chemicals that happen in hypnosis and meditation. Some melatonin gets released, yada, yada. So a person is very receptive to suggestions in that stage before they go to sleep. And then, of course, if they fall asleep, that's okay too, because the subconscious mind, which is who we want to talk to or what we want to talk to, the subconscious mind is open 24/7. It's Max Milk. It's the 7-Eleven. It never closes. So by doing that, by having that reinforcement on a daily basis, I get real speedy results.
Yeah, I would imagine, yeah. Now, regarding suggestibility, it seems to me maybe sometimes there's a danger when it comes to self-guiding suggestibility, and by that I mean there are people who are estranged from their families, maybe they're angry at their parents, and sometimes one thing that has happened is someone thinks, I must have been abused by my father when I was 2 years old. I don't remember it. It must have happened. He's a terrible man. Yeah. And then in some cases, they fully expected to perhaps witness an incident of sexual abuse while hypnotized, and then they saw it, but that was their imagination. Yeah. And it tore the family apart. Like one famous example is Axl Rose of Guns N' Roses did that. So he's convinced that his father sexually abused him when he was 2 years old. So have you ever had people tell you that? I'm pretty sure that such and such must have happened.
Yes, yes. And when someone comes to me with an abuse background or what they believe is an abuse background, then I have a whole lot of questions that I ask, because, in an abusive home where maybe the father is sexually abusing a son or daughter, who knows, there are going to be certain patterns, certain commonalities that probably only someone who works in mental health would know. There are 25 things that would back that up to me. But I always believe the client. I want them to tell me whatever is in their thoughts. But absolutely, it has happened that when we have done a regression, we find that there is no abuse there. Mm-hmm. There might be some scary things, there might be a spanking, or there might be, but nothing like what the imagination has created, which is why hypnosis in children is a very what shall I say? It's a very slippery slope. Now I am certified in pediatric hypnosis, and I do pediatric hypnosis myself. My rule is I don't like to work with anyone who is under 12. For a whole lot of reasons. Mm-hmm. First of all, they mostly have the attention spans of like a flea. You can't really get them into trance, but you have to rely on those recordings that they hear when they go to sleep. So we can do it. And, of course, a lot of kids come to me, 12 with bedwetting that's gone on too long, this, that, the other thing. Sometimes I can always help. Sometimes I can help a lot with ADD, or if a child is having episodes of anxiety, I can often help tremendously with that without, having to add in medications. And again, let me say I am not anti-medication, mm-hmm. but using SSRIs or SNRIs with teenagers or tweens it can have unpredictable consequences. Most of the time it's fine, but as a blanket thing, why not try hypnotherapy first? Mm-hmm. It's not going to hurt anything or make anything worse. Why not give an alternative therapy like that, a chance?
Yeah, I wouldn't dismiss psychiatry, but it seems like maybe they emphasize the symptoms a little too much.
Yeah.
Why not go to the roots?
Well, yeah, and you can easily, I'm sure, get, a lot of false diagnoses, and you have this horrendous idea about what's going on with your child, and it's really not accurate. Mm-hmm. I mean, I've had parents come and tell me, my son was diagnosed with borderline personality disorder. Absolutely no sign of anything like that. Okay, I've had parents completely wigged out by ADHD, and indeed, yes, it happens, but most kids do grow out of it. Mm-hmm. And if there are medications that can help, but a lot of the time it's just the kid's brain firing. It's smart kids with their brains firing. And, I remember I used to sit in school, and I think that what was going on in my head was a lot more interesting than what I was hearing from the teacher. And I'm sure I looked like I was just completely out of it.
Yeah, and most of the overdiagnosis of ADHD and related conditions have been with boys, but isn't it usually a matter of boys being boys?
I have to agree, and that may not be a popular opinion, but in fact, ADHD, Tourette's syndrome, there are many things that are sort of related to the anxiety spectrum. There are many of these things are much more common in male persons. And I'm talking about if it's a real thing, like Tourette's, which you would obviously be able to see happen for one reason or another. But still, women do get it. Women do inherit it.
Yeah.
Females do inherit, but at a much slower rate. Primarily, especially Tourette's, is primarily a male issue. Unfortunately, we don't know why. I have a hard time believing it's environmental when the data goes across all kinds of spectrums of homes and nationalities and cultures.
So in terms of the brain itself, looking at the neurological impact of hypnosis, can your work, when hypnosis is successful, can it actually alter the chemistry of the brain or even the brain in a physical way?
Yes. In fact, I'm sure you're so knowledgeable. We really now are just beginning to understand the neuroplasticity of the brain and the fact that we can create new neural pathways. And that's essentially what has been done since the dawn of time. We disconnect the negative patterns, the negative habits, the negative whatever, what have you. We disconnect that and we stimulate and help the client to create new healthy neural pathways. Now also there's tremendous evidence about the healing power of hypnotherapy and the healing of the brain. If someone has had a stroke or whatever, if you can communicate with them, that you can stimulate certain parts of the brain to reestablish themselves. So but the mind-body connection is huge.
Absolutely. Speaking of which, so when we bottle things up, whether it's anger, pain, whatever, all these negative emotions, well, they don't just disappear. They kind of seep down into the unconscious and they remain, right? That's kind of
they can, unless you deal with them. And, there are many people, like my late mother-in-law didn't believe in the subconscious mind. She was British. She didn't believe in it. She just...
Yeah.
I'm not sure what being British has to do with it, but, there was a very stiff upper lip. Pull on your big girl pants, do what has to be done. It was very much like that. So people can refuse to progress, but if someone is tired of carrying the anger or the fear or the discomfort, all they have to do is want to make the change. All that's required, like if you were coming to see me and you wanted to deal with this pesky social anxiety, it would be a very easy matter to do that, because you would have the desire to make that change. And everything that hypnosis does is about brain chemistry.
Yeah.
Absolutely. I feel everything about it. And even if people are coming to me and they want to be more enlightened spiritually, then we wake up the pineal gland. We do, clear the I will definitely go into those areas. But it's, someone once said to me, and I think this is very, very telling, holding on to bitterness and anger is a lot like taking poison and then waiting for the other guy to die.
Yeah, it is.
It is poisonous to our systems, and I firmly believe that part of the massive amount of cancers that we have are stress related, anxiety related. In fact, I might even say that almost everything is anxiety related.
Sure, yeah. Addiction. Yeah,
addiction.
That's a big one,
It's fear based, and then it also has to do with very much with the core personality and what happens to that child before the age of 3. There could be attachment disorder, which slows everything down and has other consequences. There can be a lack of attention or physical contact, which actually affects brain development.
Oh, it can. Yeah,
So there you have it.
And I'm glad you mentioned the pineal gland, because for one thing, now I know how to pronounce it correctly. But you've conducted past life regression hypnosis sessions.
Yes.
So have any of your patients reported things while hypnotized that can't be explained away? People can be very skeptical about this, but have you ever thought that's got to be real?
Do you mean in a past life regression?
Yeah, where they said things like, this doesn't sound like somebody watching a period movie.
Oh,
this
my
sounds like
goodness,
something that
yes, where you hear things, and even myself as a history buff, I'm always on the History Channel and watching this, that, or the other. I often hear things that I had no idea about, which are quite intimate or just unknown to me. Doing past life regressions is absolutely fascinating. Well, my whole work is fascinating. I'm fascinated with people and the way they think and the tremendous, with snowflakes. We're all individual. I am constantly fascinated. And when you get into the area of past life regression, then that fascination, it can increase exponentially.
Yeah.
Now, I am a real, I would say almost a direct descendant of this process to Michael Newton, one of the great, great contemporary innovators in past life regression and interlife regression. My great teacher was Dr. Georgina Cannon, and she was his student. So my method, what I do, comes directly from, the contemporary guy, Michael Newton. And I think what's fascinating is sometimes I never know what I'm going to hear, but I will say this, that when a person comes for a past life regression, particularly if they have an issue that they're grappling with in their present day life, they will invariably recall the lifetimes that they need to hear about, that have a correlation, or like, look, that was your pattern. Look, that person you can't stand, that's your mother now, she was a cheating friend who was despicable. I mean, you kind of hear what you need to hear.
So is it related to how, like, one of the beliefs about reincarnation is that it's about resolving karma? So your mission as a soul has not been completed. You're here again to resolve something that you in a previous life you didn't.
Well, that can certainly absolutely be the case, but I think that whether or not you come back is primarily choice. And now, if you notice, when we've experienced population booms like after World War II, a lot of soldiers that were killed during World War II came back very quickly. I have a large percentage of people, both male and female, who will recall like their most recent life. The same thing with World War I. So many people whose lives were cut short do seem to come back in really quickly. But I believe it is a choice. Now, to go into those areas, we probably should focus more on the interlife experience, which is really that's where we really live.
Yeah.
That's home. This is a dense, physical schoolyard full of bullies, right? That we have to negotiate our way through as a learning experience and grow our compassion for others and our empathy. This is a school. And I think you can choose to progress on the other side, if you wish to use that expression, without taking physical form. But I think you progress more quickly and more deeply and more easily if you come down here.
People who have come back after having done these particular sessions, have they reported any kind of change on them personally or their lives?
Oh, yeah. Usually they feel a huge lightening of spirit, as if a big weight has been taken off their shoulders. And now, if they look at their bitchy mother, you don't have to be so reactive, because you say, well, this is the same tormented, awful soul that I had to deal with last time around. So that's her problem. I'm not going to feed into it. So it gives you, I think, a beautiful kind of an overview about everybody being on their own path. Now, one thing I will mention, and this is something that people don't often think about, it's very easy in a life, your life, my life, to say, well, this is a negative person and this is a positive person. But sometimes souls, out of great love, come in and assume a negative role if it is going to be a valued learning experience and propel that person, like maybe a nasty teacher or it's sometimes these people that we perceive as negative on the outside are actually souls who have said, well, I'm not going to like this, but this is so important, it has to be done right, I'm going to do it. So you can't always assume that, someone who's negative in your life is a negative person and is part of some karmic debt. I'm not sure if I believe in a sort of a Tibetan wheel of karma. I do know that what seems to happen, and this is very well documented, is that people incarnate in groups We are in
Yeah, I suppose so, yeah.
soul groups with, I don't know, X many people. I'm not sure how many. And the thing is, it's like recasting a play. Every time you come in, you switch roles around to have a different, wider, deeper learning experience. And I remember when you're learning how to do past life regression and all these other things, of course, you work on each other. It's in a class, and you pair off, and you practice, and you work. So I had a past life regression done by just a student so many years ago, and it was an interlife regression. I'm sorry, what happens before we come in? So in the interlife regression, I recalled clearly that my brother and my sister, my brothers passed, but were so close. My brother and my sister wanted to come back in for physical experience for a whole lot of reasons. But they didn't want to come in without me because they said, we need you to deal with the person that's going to be the mother. Mm-hmm. And I said something like, oh, not again, probably. Right? Oh, not again. But I remember that they wanted it so badly that I got excited about it. I said, okay. And then in the interlife, there seems to be a room or a place, a quiet, beautiful place where people condense their energy and get ready to move into a small infant body. I don't know exactly when this takes place, if it's immediate or fast, but I have a recollection of it happening. And talk about let's get small.
Yeah.
Anyway, so sure enough, we get my brother and sister. I'm the firstborn. I'm the eldest. And my mother was a flaming biatch, as we knew. And I always took the bullet, for lack of a better term. I was the protector of my siblings. And there was a big age difference between myself and my beautiful sister Karen. And I even remember my mother coming in and saying, I don't want to hear this baby. If this baby makes any noise in the night, you better take care of it. And I was 6, 7, and she was an infant. But, that is the role that I accepted. So now I say, well, I take complete responsibility. I knew how hard it was going to be.
Yeah.
I knew what she was going to be like. And I did what I needed to do for my siblings. And that's that. And
with another type of regression therapy, the work you've done with abductees, or did you have another term, experiencers?
Well, I think now we used to say abductees all the time, but it has a real negative spin on it, just the word, and the fact that most of the experiences people have are positive. We now call these very special people experiencers or contactees.
Oh, yes,
That sort of seems to describe a much more accurate experience.
And
what
comparing
they have.
that to the past life regression, many people actually have physical wounds, markings, implants.
Yes. And stupid me, I've forgotten the word for it. I know what it is, but indeed, people can come into this life bearing physical scars from something that has occurred. It could be many lifetimes ago. Yeah, it doesn't have to be even the most recent life. If it's traumatic enough, I've seen people show me things that look like bullet holes. There was a client that recalled a life about being basically a bootlegger, a gangster in Chicago in the 1920s. And dying in some kind of big shootout. It does sound a little cinematic.
Maybe in the Valentine's Day Massacre.
Yes, the St. Valentine's. But that was going on in the 1920s. It was a lawless town. Everybody had guns. It was crazy. So he showed me, a spot on his stomach. I remember it's to the left. And I've seen bullet holes. I worked in hospital. That looked like a bullet hole to me.
Really?
And he had been born with it.
Wow, that's interesting.
Yeah, so this does happen. It does happen.
Yeah. Well, yeah, you mentioned sometimes people coming to occupy a negative role. Because I had this uncle who was just a terrible person when he was alive. And he even did wrong to me and my mother. But then a few years ago, I had a vision of him. I was asleep, so it could have been a dream. It could have been a vision. But he was just kind of appearing in light that was fading in and out against a black background, though I would think more of it as antimatter. But he said telepathically, I'm not the same person I was when I was alive, and I sense this love and peace about him, which anybody who knew him in real life would have thought must have been a dream.
There you go. He was in the family group. He was in the soul group. And for whatever reason, these decisions were put in the path, in the route, in the contract, if you will. So, but I think that it's very important to remember that this is the most important life. The reason that we do past life regression or interlife regression is for insight into the right now. Now, I don't believe in time. The time is linear. I'm more of a quantum person, and it's kind of like everything is happening at the same time in a way. So I think the healing, the mending, the releasing of negativity, when you accomplish that, you accomplish healing in all dimensions of time and space.
And the patients of yours that have been abducted by extraterrestrials, do you find typically, because I've actually watched sessions like that on television, and people can get really stressed out. Sometimes they even start screaming. Oh, yeah. Is that hard to manage?
Well, you know what? Here's the good news. If anyone out there is interested in any kind of regression therapy, there is no need for a person to re-experience a traumatic event with pain in order to release it. So what I do, and what all properly trained hypnotherapists do, is when someone is beginning to experience stress or anxiety, like say, for instance, this just happened today. This girl comes to consciousness and she's strapped down on a futuristic operating table, and there are things that are happening. She's being injected with some blue fluid. All of this stuff is going on. So I immediately pull her out and make her an observer. And that's in that way, the entire experience gets processed. They're talking to me, describing everything, and just being an observer is really significant enough to release any trauma that would have been, lingering about. At the turn of the last century, I suppose they dealt with fear and trauma, and of course, as we just talked about, they believed that it had to be re-experienced to be cured or healed. So we still treat phobias with what I would call progressive desensitization. But at the turn of the last century, if somebody had a fear of spiders, they would get a cage full. The psychiatrist would get or the alienist or whatever the person was called would get a cage full of spiders, and the person would be required to stick their hand in there. Now, at first, they could only go like that, in and out quick. But as they became desensitized to the presence of the spiders, they just could stick their hand in. Well, the good news is we still treat phobias in that way, but we do it all psychologically.
Yeah.
And no one needs to stick their hand in the spider cage or put themselves in any of these traumatizing situations. So we don't make the trauma worse. We pull the person out and make them an observer. And I also use that technique if I'm exploring anything like sexual abuse.
Yeah.
No one ever needs to re-experience trauma.
Not. It could be re-traumatized.
Yeah, you can, and there's no need for it. We know now there's no need for it.
So do you believe the pineal gland or pineal gland? So do you feel that
we have pineal glands up here in Canada?
That is true. Yeah. That's right. At St. Lawrence Market.
We do. You can get them. Different sizes.
Yeah. Do you think there is a connection to the divine through the pineal gland?
I think there may even be. I think that evolved beings maybe are even able to negotiate space-time. By the use of the pineal gland. Now, ours, the pineal gland that most of us have is probably about the size of a grain of rice. And unfortunately, what we didn't know as human beings is that if you are ingesting fluoride. It reacts to some calcium-like component in the pineal gland and begins to crust it up, the same way that fluoride acts as a protective shield on the calcium of the teeth.
Yeah.
Fluoride is looking for calcium to then encircle. So many of us from like me, the dawn of the Plesiozoic era, we used to go there as kids to the dentist and sit in trays of fluoride.
Yeah, yeah.
So depending, on what's doing, some people do have a pretty big effect from that. So you have to eliminate fluoride. And I'm not a big anti-fluoride person in general. I think it strengthens teeth. But if you are interested in excelling or opening up your third eye, you got to stop ingesting fluoride. Now, there are all kinds of, when I'm working with people, there are all kinds of things that we do. I tell them that the gland is getting bigger, that it's creating all of the, I believe that DMT is in there.
Yeah.
The so-called, the God particle or whatever.
Yeah.
I believe that we have an incredible tool which has become latent. Now they say, and I don't know how this is known, but great yogis of the past apparently had pineal glands that were the size of lemons.
Wow.
So, there's probably no limit to what we can do in our evolution as if we allow the pineal gland to get the stimulation that it requires to assume its chores.
Sure.
Which is to facilitate all manner of telepathy, all manner of remote viewing or astral projection, if you wish to call it that, to facilitate any of these magnificent things that I believe we are all capable of.
Sure. What do you think about psychedelic therapy? It's kind of like seems to be like the goal of it is the same as your goal with hypnosis, except they take a different route. They do it chemically.
You mean the microdosing that they're doing now?
Yeah, they do it with LSD. They do it with psilocybin mushrooms. There are other, I think, DMT. Yeah, it's another one. Yeah.
Well, you know what I would say, using LSD or any type of a hallucinogenic to treat various mental health conditions is nothing new. They started experimenting with that in the 50s.
Yeah.
My uncle, Red Mitchell, late jazz bass player, my Uncle Red Mitchell was getting LSD 25 from his psychiatrist for depression. And so he and his wife were like tripping all weekend. That was, so this is not new. But I think what is new is the concept of the microdosing. And sometimes people's nervous systems need a boost.
Yeah.
I'm not going to say that it doesn't work because first of all, I don't know enough about it yet. And B, I have to throw away my old prejudices because in the 60s we used to take this stuff recreationally, and it's hard for me to imagine how anything like that could be therapeutic. In the big picture.
Yeah.
I don't really quite understand it, but I'm certainly not going to dissuade it. And people have had my nephew is in mental health care, and he assists people when they take DMT. He acts like a guide so that nobody gets freaked out so I would say if you are going to experiment with DMT, it would be a good idea to have a trusted friend or somebody who knows how it all works to be with you.
Yeah.
Is what I would think.
Yeah, I guess it depends on the individual too, because even with me with marijuana recently, I haven't been smoking it as much because I always end up being possessed of negative pathology, looking at everything negatively, remembering negative things from the past.
Well, are you smoking or are you ingesting sativa rather than indica?
No, just the indica, but it just triggers a lot of negative thought patterns.
Well, you know what? Maybe you've smoked enough.
Yeah, maybe. Yeah.
Maybe right now it doesn't. And I will tell you one thing, that the more I am involved in meditation and other healthy pursuits, the less weed I smoke.
Yeah, I would
And
imagine.
I do smoke a bit of indica weed for an inoperable back pain management.
Oh, yes,
So
yeah.
I don't get a psychoactive effect. That indica, it's all it does is make the pain less.
Sure,
I
yeah.
don't really manifest anything else, so I don't get any paranoia or any of those bad feelings. But that little bit of herbal help allows me to live a pain-free, almost 100% pain-free life without any poisonous, pharmaceutical opiates
Yeah,
or
yeah.
anything of that nature.
Yeah, that is a great thing about it. I just don't need it for pain. So,
No, and
yeah.
you know what? I would say take a break.
Yeah, sure.
Just if it's not feeling good, if you're just going through the motions because, oh, this is what I used to do to control anxiety or whatever, just give yourself a break. And then maybe next month, see if it's okay. But you may be becoming, your system may be changing. You may be waking up and you may have so much of this good stuff running around in your system now that you don't, that the marijuana is not working in the way that it did.
Yeah, you could be right, because the last few years, it's like a fog lifted, and I became more cognizant of my own mental health issues.
Mm-hmm.
And maybe the realization of that has exposed a lot of material that gets dredged up when I'm high. I guess that could be happening.
Well,
then.
it can. And any time that you feel that something upsetting is coming up and you don't, and it's just, oh, wow, this is not something I want to think about, just take 5 deep cleansing breaths. Just stop, take 5 cleansing breaths, and purposefully flip your thought.
Mm-hmm,
And to something really happy, something that's a great moment of love or family, whatever it is. So the combinations, and you will be, in fact, rewiring your brain not to experience an anxiety reaction from anything in the past that might bubble up.
Yeah, we're more in control than we think.
We really are.
Yeah.
We really, really are. And in working with healing, with helping with cancers and pain management, I have seen miracles. I'm not saying that I was completely responsible in any way, but I know that people who have wanted to get well and were dealing with cancer have come to me along with other wonderful therapies, maybe acupuncture, maybe this. So they are doing a mind-body complementary therapy in addition to whatever they feel is required from the traditional medical mainstream thing. So, but I believe that we can get a hold of wiping out cancer cells with our mental abilities. I believe we can. And I use a lot of metaphors. I have people blow up those cancer cells. I am myself a cancer survivor of many years. Mm-hmm. And I know, without knowing anything about hypnotherapy, I was very young, I visualized, I used to just close my eyes and I visualized. Now, I don't know why I visualized a Civil War scenario as opposed to maybe World War II. But for me, racist Southern idiots and slavery, that is so strong that that's what I used. I don't know if I had a life there. I don't know if I was an abolitionist, but I really react to it. So I used that. And I would envision, of course, the Gray Army, the rebel. I would envision them as the cancer cells. Yeah. I mean, they would be, and then I would have send my Union Army in to blow them up as violently as I could imagine.
Or as I recall, I've heard many stories about how somebody was very ill and they just decided to surrender to it. They just decided not to fight it anymore. Could have been cancer. Could have been any number of things. Like I remember Pierre Elliott Trudeau, when his son died, he was already ill, but he just decided, I think that was just too much. He just couldn't summon the will to live anymore.
I think you're right.
And whenever that happens, the person goes very quickly.
Very quickly.
Yeah.
I completely agree. When my late brother passed, both of my parents had cancer within 6 months.
Really?
My mother survived, my father didn't. But my father's guilt and issues with my brother were bigger. So, but I think their hearts were broken. They as my father gave up.
Well, it all comes back to the brain, right? The
Yeah.
brain's connected to the whole system, so
It is.
yeah.
And, I think there's some thought that when we're in the interlife, we create exit points for ourselves.
Sure.
That we can activate, like possible timelines that we can activate if we need to. And most people have at least 6 exit points. When you say, wow, if I'd been there 2 seconds later, I would have been hit by that train. There are things like that happen to all of us. And I believe we do have exit points that we can access if our contracts become too hard.
Sure. Speaking of exit points, we're now going to go to a break, and we'll be back with This Crazy World, How Aberrant Behavior Shapes Our Society.
Whoa.
This show has been brought to you by Voices for Ability Radio. Voices for Ability is Canada's first internet-based radio station dedicated to individuals with disabilities, their caregivers, and allies. They are a source both entertaining and informative that focuses on issues faced by individuals with disabilities on a daily basis. All of their talk shows are produced and presented by individuals with disabilities and highlight the people, organizations, and resources that make a difference in the daily lives of individuals with disabilities. Join them for conversations about employment, relationships, advocacy, and accessibility, among other things, at www.v4aradio.com. Okay, so we're back. So how do you feel about Tori Stafford's mother being put in an Aboriginal healing lodge? Can someone like her be redeemed? Are they going way too easy on her, do you think?
Well, only someone who's never been to prison can say going way too easy. I think we were dealing with mental health issues from the get-go, and I believe that redemption is possible for everyone if they are shown love and care. I mean, what we see in the prison systems, the recidivist behavior we see is the result of oftentimes horrendous parenting, and it perpetuates itself. So we know prison is not the answer.
Well, I mean, I would certainly be interested in knowing how someone could bring themselves to commit such a heinous crime. If she could do that to her own daughter, I don't know what her parents did to her. So that's, I certainly don't know everything about this woman's background.
Well, she may have had a dissociative episode.
Yeah.
She may have had a psychotic break, and she may have no memory of what happened. This is possible. But I think until we start addressing the mind-body connection and really addressing addiction, really addressing addiction, not just granting people bail and telling them they have to go to AA 30 times. We are primitives. If you look at, we are primitives in the way in our system of in our penal system. In fact, it's hard to believe, but Canada is not rated very high in penal systems. You would think that being a forward-thinking country, it's not. It's way down there.
Yeah, we don't emphasize rehabilitation.
No.
It's more punitive, yeah.
Yeah, and then I believe most of the prisons in Canada are jobbed out to independent companies run by Mormons who are providing all the guards and all the, the wherewithal to run these places. And whatever we're doing, it's not working. And I believe there is redemption for everyone. I believe she most probably had a psychotic break. And I believe in a healing, I believe in a loving, forgiving God. Or for intelligence of the universe, the creative force of the universe. I don't want to put any kind of religious spin on it.
Yeah.
Everybody is entitled to their own interpretation of that. But I do believe that ultimately it is a fair universe. Ultimately it is, which is one of the reasons we have reincarnation.
Yeah. Well, I know I've heard a lot of criminals who were possessed by a pathology where it wasn't a one-time act, where it was repeated. They would say, something would come over me. That phrase keeps coming up. Jeffrey Dahmer said that.
Yes.
A lot of sex criminals say that, actually. Something came over me. I couldn't stop myself. So,
it is uncontrollable, and they disassociate. And that kind of sickness may or may not be something that involves environment. Jeffrey Dahmer grew up in a very normal home.
True, yeah.
You know, there was nothing to indicate the depth of his psychosis. Nothing. The father said he first started to think something was odd because of Jeffrey Dahmer's obsession with like roadkill, with like dead animals, that he thought was a little odd, but certainly nothing that would have ever led him to believe that his son would be the monster.
Yeah, there was some discord, but nothing, no abuse going on.
Yeah, I mean, who doesn't have discord?
Yeah.
God, you know, that's what being a teenager's all about, disrupting everybody. But yeah, it's I believe in healing, and I think that all psychiatrists should be using hypnotherapy. I think all practicing psychologists should be using hypnotherapy, as it is more commonly in Europe.
Yeah, well, and it's such an individualized therapy. That must be what makes it so effective as well.
It's individualized, and it does no harm.
Yes, exactly.
It does no harm. I mean, for example, this is a little bit off topic, but we're talking about mental health, and you know, I'm really forbidden by law to use hypnotherapy with anyone who has been diagnosed with a mental illness. Now, within that framework, you know, I don't consider, you know, depression a mental illness. I don't consider anxiety issues a mental illness, or any of the neurotic things that happen. But I did have. It is not unusual for me to receive a doctor's letter, and if I receive a letter from a psychiatrist and I'm going to work on a specific thing with a patient that has been diagnosed, say, with borderline personality disorder or something, I am legally allowed to do that. And not too long ago, a psychiatrist called me. He had a patient who was experiencing terrible insomnia, but he didn't want to administer any more drugs because it would interfere with whatever the psychotropic medication was doing. Everything was balanced and controlled. So he said, please, I'm writing the letter. Well, you know, I worked with this lovely person for, maybe 2-3 sessions. Insomnia cured. No extra meds added. The person is living a normal life. She's an accountant. I mean, you know, so, you know, I can work with people who have been diagnosed with what you would call a mental illness, schizophrenia, with, a psychotic effect. I can, if a psychiatrist will allow me to.
Yeah, antidepressants just made me sluggish. That's all they did to me.
Well, you know, they don't work for everybody. Don't get me wrong. Thank God we have them, because
they do work for some people.
They can work miraculously for some people. There is and I must confess, after the death of my brother, I experienced clinical depression, and I did use antidepressant medication for a while with therapy. I don't think you can just give somebody, you know, some, Paxil or whatever and just send them on their merry way. It has to be a combination of therapies for those things to work. But in my case, thank God, my nervous system needed that boost, and I started making serotonin again, and I stabilized. But there are many people who have unsuccessful results with antidepressants, and there is also what they call treatment-resistant depression.
Yes, absolutely.
And in which case they've tried everything. So there's nothing I like better than to get in there in one of those situations and teach someone how to release their own feel-good chemicals, the serotonin, the dopamine, the endorphins, how to just turn it on. I have them visualize a dial where they turn it all the way up and then give their limbic nervous system the suggestion that the levels will always remain perfect. You can talk right to the nervous system. You can talk to the heart. Boy, you can talk. I do lots of work in fertility support.
Yeah, really.
And my record right now is 100%.
So they become more fertile?
They get pregnant.
Wow.
I'm talking about people. I don't say the word infertility anymore. You know, I say we're doing fertility support. It's always got to have a positive spin. But hypnotherapists in general, we have a 60-70% success rate treating undiagnosed infertility problems. That is, you don't really know why the couple isn't getting pregnant. The clinics where they do everything invasive and medical that you can possibly imagine, they only have a 50% success rate.
Mm-hmm.
So come see me first.
Yeah.
Yeah. Just try it. Try it. You'll like it,
Yeah. So going from the micro to the macro, as an armchair psychologist, social psychologist, there's been an increase in economic instability and worker insecurity in the last 30 years.
Yes.
And it seems to me this is an enormous cause of anxiety and depression now. And that anxiety is causing, it seems to me, increased rates of obesity, diabetes, other medical conditions. Anxiety is just, it's like poison, isn't it?
It certainly is. And remember that when you are anxious, you are always triggering that primitive part of the brain, the fight or flee mechanism, that was designed, so by the great architect so that the caveman could run from the dinosaur and run for a long time without losing weight. So if you are trying to achieve a healthier weight, if anybody is, stress and anxiety will absolutely interfere with that happening.
Sure.
Because as soon as you start leaking corticosteroids and adrenalines and all these nasty chemicals that come along with anxiety and stress, you will not be able to lose weight. Your tummy will make a lot of stomach acid, all kinds of things. Oh, of course, your ability to process cholesterol is nil. Stress and cholesterol rates with the bad cholesterol, huge connection. So it's stress and anxiety are so prevalent in our society. And as you say, people are worried about their jobs. Young people are worried that they'll never buy a house. People are always on social media, so they're more isolated than I've ever seen them. People are more isolated than I've ever seen them.
Yeah.
I had a lady who came to me who's a beautiful artist. She has so much social anxiety. Because she's so involved in all this stuff. She's afraid to go to a painting class. She's afraid people are going to look at her strangely or something.
I get it, yeah.
You get it, right?
I have diabetes, and I think even though I've been treating it and I've adjusted my lifestyle to a dramatic degree, I think the anxiety is preventing me from making more progress in reforming it.
I think that's probably true. I think that's probably true. Do you do some type of meditation practice, something like that?
I would. The only time of day I could really relax my mind is around 5 o'clock. But I hope that there's something I do every day where I'm socializing. I try doing it at midnight, but I don't know if this happens to everybody. But my brain is really active at that time, late at night. I don't mean to toot my own horn, but they say the smarter you are, the more active your brain is at night. But
that's a very. There are a lot of very smart people staying up all night. That's for sure. It seemed to go with the package there. But yeah, the reduction of the diabetes. I've had many people go from using the type 2 diabetics that go from injecting insulin to maybe metformin or Ornase or something, which is a tablet, to sometimes nothing. So it's possible.
Okay, I got to make an appointment real soon. Right? And thank God you're right down the street, too.
I am. I'm conveniently located.
Yes, okay.
That's for sure. But yes, stress is and our society today is loaded with it, maybe as it's never been before.
I think so, yeah.
And men and women don't know what to do, how to act.
Oh, yeah.
I'm not saying the gender roles are great or good.
Well, they don't even know what gender they are anymore.
No. I mean, I was hosting at the Kensington Market Jazz Festival last summer, and I saw all kinds of people who were really gender fluid.
Yeah,
I thought, well, that's cool. We did that in 1969. We all looked the same. I had the same T-shirt as my boyfriend. I wore his jeans. We both had the long, stringy hair. Again, gender fluidity is nothing new. But
I think there was a lot less anxiety at that time because the economy was so good. People talking about peace and love during a good economy. Yeah. I don't think it's a coincidence.
Well, a big war will always stimulate the economy, and that was always the issue. Speaking as an American, the issue with the Vietnam War was always about stimulating the economy.
Oh, yeah.
That was always the goal. That was Johnson's goal from the very beginning. He was a hawk, as we say there. I don't know if you say it here, but somebody who's really into a military solution.
Yeah, that's right. So we talked about addiction earlier, and how you treat addiction regularly.
Mm-hmm.
The opioid crisis has been in the news a lot.
Yes.
So have you treated anybody for that particular addiction? And furthermore, I was going to ask you as well, what do you think needs to be done to deal with this crisis?
This is a huge, huge subject. I think all drugs should be legalized and controlled.
Mm-hmm.
As we have done with marijuana, I don't think that we are ever going to solve the problem of drugs by keeping them illegal, letting people get tainted heroin, letting people get heroin that's laced with fentanyl. The reason that these terrible things happen is in a large part due to no control over the material. We need to be more European. We need to have safe injection sites.
Mm-hmm.
We need to not lose any more people to this fentanyl crisis. The only way to control it is to control the quality of the marijuana of the heroin that's available.
Mm-hmm.
As I understand, this is what's happening. It's fentanyl is being mixed in, or people are using it instead of heroin. So apparently, it's available illegally everywhere. You know, it's horrific. It's horrific in Vancouver. Maybe even more. Yeah. And Vancouver's always been a heroin town. You know, that's because that's the first stop from Asia.
Yeah.
So it's always been an issue there. They've always had a big problem with that, and now it's even worse. So I guess my answer to that would be the first thing is all of these narcotics must be legalized and controlled. And then we have to make facilities, real rehab facilities, available to everyone that wants to get better.
And I know it's probably easier said than done. Science was never my strong subject in school, but science needs to come up with a way to create non-addictive pain management. Because pain is almost impossible to live with, right? That's very
well. You know, they have to get behind. With CBD oil, we're pretty close to that. You know, CBD oil is, of course, again, extremely non-psychoactive, and people are being cured of epilepsy. Wow. There is quite a bit of evidence that it attacks cancer cells. It's an anti-inflammatory. So there is non-opiate pain management available. But the problem is these people want to get high.
Oh, I see. Okay.
You know, I don't think, when we're talking about something that's offered to someone in hospital, it's a different story. What you're talking, these people, they are addicted and they want to get high. The problem is the opiate molecule is very, very similar to the endorphin molecule, so our body accepts it so easily.
Sure, yeah.
We've got receptors for it. So that's, once you use it,
Yeah, I found out something interesting about the brain chemistry related to addiction. This study found happy people are less likely to become addicted to drugs than people who are unhappy because they already have the endorphins being released.
Yes.
So there's not really a huge difference, whereas someone who's chronically depressed, their brain's like, oh, that's nice. Let's get more of that.
That's right. They are self-medicating.
Yeah.
Now, again, we need to determine of the people on the street who needs mental health care, who needs just to be given housing.
Yeah.
That problem of homelessness and drug addiction has to be solved.
Sure, yeah.
And it can only be solved person by person by person by going in there and helping these people individually and finding out what they need. Decriminalizing, taking drug addicts who buy drugs for their own use, taking them out of the penitentiary system.
Yes, yeah.
Stop treating them like criminals.
Yeah, it's a medical problem.
People are born, the interesting thing, people are born, and again, predominantly men, don't know why, but predominantly men are born with the genetic predisposition towards addiction. But there has to also be a trigger.
Yes, yeah.
Sure. You can't, because lots of people come in with an addictive gene set up, and they are not addicts. So it has to be a perfect storm. You have to come in with that thing. Maybe you pattern after your father, or maybe you're taking your first drink at 12 or 10, trauma, or just environmental situations. It's, any kind of reason can happen. But these people should never have been, and should not be now criminalized.
Oh, absolutely not.
Yeah.
Well, thank you so much for joining us today.
Is that it?
Yeah, it's been a very stimulating conversation.
It flew.
Oh, absolutely. And so before we go, tell our listeners if they're interested in hypnosis, how can they book an appointment and get in touch with you? What is the URL for your website?
Well, you can go to bloomhypnosis.com, and that is the Bloom Center for Hypnotherapy in the Danforth, conveniently located at Chester and Danforth. And you can give us a ring at 416-454-8041, or you can just go on the website and check things out. Now, I also have my own website, which is lightworkhypnosis.com. And you can always email me at Lesley, that's Lesley, that's the female spelling, but nobody knows it.
I know that, yeah.
Lesley at lightworkhypnosis.com. And I will be happy to chat with you on the phone, and you can come see me for a consultation over at Bloom Hypnosis at no cost, half-hour consultation.
And I noticed you either had a podcast in development, or you have one.
Oh, I have for quite a long time. I've had a show that's available on YouTube called Contact TV. It was Contact Radio, and we were on Blog Talk Radio for some years. And about 3 years ago, we went to a visual format. So my colleague Wes Roberts, who is an experiencer, and myself we use Skype, and we interview the who's who cognoscenti of the ufology world. People like Linda Moulton Howe and Captain Randy Kramer.
Whitley Strieber, by any chance?
I know Whitley Strieber. I would love to interview him. Yeah. We've tried to have him on the show a few times, and it just didn't work out, but I know we will. But I know him, and he's a wonderful guy, wonderful person, fascinating guy,
Travis
very brilliant.
Walton,
I have interviewed Travis Walton.
Brilliant.
I have. And actually, in the new year, probably in February, my first book will be published, and it's called Intersections: A True Story of Extraterrestrial Contact.
Wow.
And it is about the story of my colleague Wes Roberts, and we had something like 42 hypnosis sessions together,
really? Yeah.
And it's all about his experiences and his journey, but it is really fascinating. I've included a lot of actual transcripts of the hypnosis sessions, which is something you don't see too often in this type of literature. So I think the reader will feel like they're really involved in what's happening.
Well, I'm going to read that for sure. It's funny. It fascinates me, but it also keeps me up at night. It scares the hell out of me.
Keeps me up at night too, I tell you.
I'm afraid to look up past the page. Am I going to see aliens there?
Oh my goodness! Well, listen, it's. I will bring you a copy as soon as it's out, and
great. Thank you.
I think you will find it more comforting and fascinating than disturbing.
Oh, I'm sure.
Yeah.
Well, thanks again for joining us today.
Thank you so much, and I'll love to come back and see you again sometime. And in the meanwhile, everybody, just breathe.
Just breathe. Yeah.
Just breathe. Okay.
And for the Flan Foundation for Mental Health, I'm Morgan Rector, and that was Lesley Mitchell-Clarke. Bye for now.